The system that I chose is the female reproductive system because I personally feel that nobody would exist if this reproductive system did not exist. The anatomical location. The anatomical location of the uterus is between the urinary bladder anteriorly and the rectum posteriorly. As you can see in the picture below, it shows the reproductive system, the fallopian tubes, the ovaries, the uterus, the cervix, and the vagina. Description of the uterus. 80 to 200 milliliters is the volume that the uterine cavity can hold. 8 centimeters long, 5 centimeters across, and 4 centimeters thick is the average dimensions of the uterus in an adult female. The cells located in the system. The female sex cells are the egg cells or the ovicells, which are produced and sustained from the female reproductive system when transferred to the sperm cells, which fertilize them and create a comfortable environment for the developing fetus. Tissues located in the system. The ovaries, the uterus, and the fallopian tubes. The egg production. 1 million or more eggs in the ovaries contain all the eggs that will ever be produced. The eggs do not mature until a female starts puberty and sexual maturity. The egg is released from an ovary after it matures for about a month every month. This occurs until approximately age 52 years old. By the age of 52, most likely viable eggs will be depleted and hormone levels can no longer support the monthly cycle, which causes menopause. Not as often, ovaries will release one egg at the same time. If the eggs are fertilized, that is when fraternal twins are made. Oogenesis is when the fetus is carrying double X chromosomes from the process of producing eggs in the ovaries. Undergoing mitosis, oogonia are diploid germ cells. There are 2 diploid cells. One is called primary oocyte and the other is retained to help maintain a reserve of oogonia. The maturing of the follicle. An egg is released about once a month at the beginning of puberty once one of the follicles in an ovary undergoes maturation. The number and types of cells change as the follicle matures. Meiosis resumes within the follicle from the primary oocyte. The first polar body is a secondary oocyte and a smaller cell which began long before birth and completes meiosis I. Both oocytes have haploid cells. The secondary oocyte begins meiosis II but only completes it if the egg is fertilized. Releasing of an egg. The secondary oocyte forms when the follicle matures in an ovary, which takes 12 to 14 days. The secondary oocyte from the ovary is released when the follicle bursts open and the ovary ruptures, which is called ovulation. A structure called corpus luteum is formed when the follicle is emptied. The secondary oocyte is swept into the nearby fallopian tube. Changes in the uterus. If fertilization occurs, the follicle is maturing in the ovary and the uterus is going through changes to prepare it for an embryo. The endometrium gets thicker and becomes more vascular. The oocyte is fertilized during ovulation as the cervix goes through changes that help the sperm reach the oocyte. The cervical mucus becomes thinner and has more alkaline, and the cervical canal widens. Fertilization. The fertilization of an egg and sperm normally happens in fallopian tubes. The sperm swim through the vagina where they are deposited through the cervical canal to the uterus and then through the body of the uterus to one of the fallopian tubes. The tubular fluid helps carry them through the tube toward the secondary oocyte, which promotes fertilization. Molecules are released that guide the sperm, allow the surface of the egg to attach to the surface of the sperm. The egg absorbs the sperm and fertilization occurs. When fertilization occurs, the sperm passes through the fallopian tube as a second oocyte. It is fertilized as it completes meiosis II, forming a diploid zygote in another polar body. The zygote goes through the fallopian tube to the uterus, then undergoes several mitotic cell divisions. It reaches the uterus up to 5 days after fertilization and consists of a ball of cells called a blastocyst. The blastocyst implants itself into the endometrium, lining the uterus, and gestation begins. One of the major functions of the female reproductive system is carrying one or more offspring from fertilization until birth. It involves almost every body system, including the cardiovascular, urinary, and respiratory systems. This maternal organism plays a major role by providing all the nutrients and substances needed for normal growth and development of the offspring. Nutrients are needed in a greater amount through pregnancy to meet the needs of the fetus: folic acid, calcium, iron, and omega-3 fatty acids. The first trimester starts at fertilization and goes to 12 weeks. Symptoms of pregnancy are happening at this stage even when most people do not know they are pregnant yet. Frequent urination, a menstrual cycle may be missed, pain in the nipples or breast, or increased appetite. There may be nausea and vomiting known as morning sickness, which can happen any time throughout the day, not just morning, but is more common in the morning. Some women lose weight in the first trimester from morning sickness. The second trimester. The second trimester is the 13th to the 28th week of pregnancy. Usually a pregnant person will feel more energy. The morning sickness, vomiting, and nausea should be gone. The weight gain will start to happen in this trimester. At week 20, the fetus should be large enough that the mother will begin to feel it kick. The third trimester. The third trimester starts at 29 weeks and can go all the way up to usually 40 weeks. Making up a larger portion of the abdomen, the uterus expands rapidly in this trimester. The movements in the fetus become stronger and more frequent and could become disruptive to the mother. Heartburn, varicose veins, frequent urination, swelling, and back pain may occur as the fetus grows larger. The fetus's head rests on the cervix as the abdomen transforms shape as it drops once the fetus is in downward position. There is more pressure on the pelvic floor and rectum, but this relieves pressure on the upper abdomen and reduces bladder capacity. Childbirth. The amniotic fluid sac, which is a fluid-filled membrane that encloses the fetus within the uterus, breaks in a gush of fluid near the time of birth, which would be called the breaking of the water. Stage 1. Labor is when uterine contractions push the fetus and placenta out of the body. Contractions become intense during the dilation stage of labor. The cervical canal begins to widen as the contraction pushes the baby's head against the cervix. This lasts until cervix has dilated to 10 centimeters, which could take 12 to 20 hours or longer. The cervix must be dilated enough for the baby's head to fit through it. Stage 2. The baby makes it to the outside world by descending through the cervical canal and vagina head first. During this stage, the mother starts bearing down during the contractions to push out the baby. Then it exits the vagina with its face facing posterior to the mother. The baby takes a 90-degree turn as the shoulders are delivered. Almost right after birth, the umbilical cord is cut and the baby is no longer connected to the placenta. The placenta is delivered. Making sure the offspring survives is how the reproductive system maintains homeostasis. This is accomplished by producing sperm and eggs, making sure all the cells are transported, nurturing the offspring, and the hormone production. Predictions of what could occur in homeostasis of reproduction if it could not maintain homeostasis could be fetal alcohol syndrome, drugs, not enough nutrients in the body, or not being supplemented, genetic mutation, or disease. A disease in the female reproductive system, HPV, human papilloma virus. HPV is one of the most common viral infections in the reproductive system. HPV can be spread from oral, anal, or vaginal sex. The vagina, cervix, womb, fallopian tubes, and ovaries are affected by viral infections like HPV and bacterial infections. HPV is an infection in the cervix. Some types of HPV can cause illnesses such as genital warts or cervical cancer. These are all of the references that were used to get all the information in this PowerPoint. Thank you.